the last 22 years, I've been going to courses and teaching courses, and I saw that there's a way to get down to what it takes to put implants into your practice. Not just drilling a hole in a piece of bone, but like, what does it take to talk to your patient through the process of the consultation, through the surgery, through the prosthetic phase, and even like how do we take care of them after the fact. So what Implant Pathway is an opportunity for the dentist to bring dental implants into their practice and to teach them that it's not just this event. Like what we don't want it to be is an event. We want it to be just another procedure that they do in their practice, like another tool in their tool bag.
So at Implant Pathway, the faculty mentor to attendee ratio is 2-to-1. So there's always a faculty mentor in the room with you to point out things, to talk things through with you for the cases. So they're much more tight-knit, a lot more like pearls being traded back and forth. Plus you get to work with a rotation of mentors. So throughout your 2 days here doing surgery, you'll work with 4 different mentors and you get to pick different brains on different topics and really get to see kind of a cool, well-rounded way to look at implant dentistry.
I think the real difference is that we are relatable. And what I mean by that is that we have no ego. We really focus on our attendees. We want a good mixture of education and fun, and that's really what this whole process should be. We've had humble beginnings. We've really have worked hard to get to the spot that we are today, and I feel like that shows in our education program.
You know, we do a dinner at my house every session, and I think that it's super important in the fact that the doctors come and they do the didactic and it's really very serious and like we're asking them to learn and hands-on and all these things. What happens is when we are done and we go up to the house and we have dinner, like people are able to, you know, they change out of their scrub, share some food and maybe an adult beverage and like really be able to get to know each other. Some of the best things about these courses are not what you learn, but who you meet. And when they come to the house, they get the opportunity to like chill out. And they may ask, you know, the mentors and myself questions that they don't feel comfortable asking in front of the room, or maybe it wasn't relevant at the time of the course. And it gives everybody an opportunity to just talk and be humans. And that's, I really think it's one of the most important pieces of this.
So my job is really cool because I work full-time in the surgical clinic. So when there's not a course going on, it's me and my team, some of the residents we have here at New Horizon, and I have the vault, which is full of, basically it's a BioHorizons catalog. Yeah, I like when the vault is called like a candy store because that's kind of what it looks like. It's like you're a little kid in a candy store. There's just everything is available. And a lot of people don't realize total amount of stuff that BioHorizons offers. I think you can get stuck into what you first learn and you kind of don't realize what's available out there. And when you see kind of the full catalog in person and what's available, it can open your eyes and be like, wow, this one company can actually harness a lot of what I need.
We have a lot of people that, you know, especially in our advanced lineup of courses, they're already doing these surgeries in their practices, but there's just something kind of in the back of their head creeping in of maybe, you know, am I sure I'm doing this correct? You know, should I be doing this? And so I feel that our attendees leave here with the confidence necessary. The biggest killer in implant dentistry is failure to launch. You spend all this time and money to go to these courses, and then you don't use any of it when you go back to your practice. And the live surgical aspect of our course is the way we negate that, putting that drill in your hands, telling you that you can do it. And so when you go back to your practice, you instill it right away.
In dental school, they'll tell you what an implant is, and like you should use the specialist route to, you know, bring them into your practice. And the mentors and I, we just don't see it that way. Many people that don't think that's for them, they leave this course and they're like, oh my God, I love this. You know, like this is all I want to do in my practice. Myself and I know the mentors, like we live for Monday afternoon when someone sends us their very first implant they did in a text message or an email. Like that's what you live for, is seeing that.